Can you see that I'm recording this? I think it's just turned on now.
Yes.
Perfect. All right, great. I see quite a few people are starting to trickle in. In that case, maybe I'll just get us started since it's 2:01, at least here in Germany. Welcome, everyone. I hope you can see my screen and the slides. My name is Raya Karimnia. I'm a public health professional here working at the WHO Hub for Pandemic and Epidemic Intelligence, and also working for GIZ, the German International Development Corporation, or the German Technical Corporation, depending on how you interpret it. And I'm also the community co-lead for the Data to Decisions community of practice. I'm very excited to welcome you to this very first episode of the Data to Decisions webinar series, how policy modeling works in practice. Just before we get started, a few quick housekeeping points. This session is being recorded. The recording and the presentation materials will be shared on the Collaboratory platform. If you prefer not to appear on the recording, please feel free to keep your camera off and use the chat for questions or comments. Please do keep your microphones muted. I see maybe there's a few that haven't muted their mic yet. Please, if you could, it does help with the sound quality. We've set aside some time for discussions and Q&A towards the end of the session, but please feel free to post your questions in the chat as we go along. This is intended to be a respectful collaborative space for learning and exchange across different disciplines and geographies, so we encourage open dialogue and diverse perspectives. I do apologize that this webinar is only being offered in English and not in more languages or other languages, but I hope maybe this is something we can also work on for the future and other webinars coming up. Finally, if you have any technical issues during this session, please let me know or colleagues know in the chat, and someone I hope from the community of practice, if I can't help, maybe someone else could also help with that as well. The agenda for today, welcome, which I've briefly done from my side. I'll just introduce you briefly to the Data to Decisions Community of Practice for those that aren't familiar with it. Then we'll jump into the main event, presentation by Dr. Lisa Hadley on how does policy modeling work in practice, a global analysis on the use of EPI modeling in health crises. And we are leaving quite, hopefully, enough time for a discussion round and questions and answers. And with that, I'll jump into just giving a quick overview of the Data to Decisions Community of Practice. This was established in 2023, 2024, around that time, looking, it's a community of practice that's addressing quite a broad and cross-cutting topic, I would say, and looking into how we turn analytics and modeling specifically into better decisions during health emergencies and in preparation for health emergencies. There is a lot of potential with infectious disease models, as I'm sure a lot of you are aware of, but unfortunately, sometimes the evidence and outputs aren't always being used effectively in decision making for various reasons. And organizations and institutions are addressing this by looking at how modeling evidence can best inform decision making, and through that are developing tools, resources, emerging best practices. But sometimes these efforts are a bit fragmented, and in addition to that, there is actually still no international guidelines or standards of practice on how modeled evidence should guide policy during major health crises, at least yet. I'm hoping maybe there will be eventually. And so with that, the goal of this community of practice is to bring together and establish an interconnected network of networks or professionals, practitioners, organizations who are working in this area to strengthen the use of infectious disease modeling for timely evidence-based public health decisions. And the vision is that public health decision making at national, regional, and global levels routinely integrate modeling and advanced analytics as one form of evidence to support health emergency preparedness and response. The objectives of this community of practice are to connect professionals, organizations, and networks align ongoing efforts to develop guidance, resources, and practices across organizations and networks, share and amplify the evolving knowledge, experiences and resources, and to support and provide the necessary tools to co-develop practical tools, guidance, and processes as well. In terms of the membership, within the community of practice, it's really a diverse mix of professionals, organizations, and networks working at the intersection of modeling and public health decision-making, and includes developers of the tools and resources, but also practitioners. These are the modelers, the analysts, the translators and intermediaries, those that are communicating the modeling outputs to the decision makers, which also, and that also includes the decision makers within this community of practice. That's ministries of health, public health agencies, quite a broad term though, I would say. At the moment, we have around 65 members on the collaboratory platform. This is the digital environment where the community connects, one form of connecting. We know that, of course, a lot of discussions also happen beyond just the platform. But if you're interested, if you haven't yet joined the collaboratory and the Data to Decisions community of practice, the QR code is there for you to join, and we welcome new members as well. I won't go through the details of all the range of activities and events that have taken place within this community of practice, but these slides will be shared and the links are there. So if you're interested to find out more about these different activities, then the link is there for you to find out more information. In terms of upcoming events, we hope that this webinar series will continue with a focus of modeling in action, how models, infectious disease models, have supported or failed to support decisions across different settings, across different settings and pathogens, and also hoping to have another series looking at the tools and resources that are available and presenting on those. Workshops that are coming up, also looking at having a workshop on how public health professionals can apply an evaluation framework that's currently being drafted by the community members, specifically the Robert Koch Institute, London School of Hygiene and Tropical Medicine, along with the WHO Hub, for the model to decision-making pathway. What I'm sharing here is just a snippet of what's coming up, and I would encourage our community members and those new as well, if you are involved in any relevant activities, please do share on the collaboratory platform, whether it's trainings, workshops, tools, resources, events, and if it's also something that you're working on that's not yet finalized, please feel free to use the collaboratory platform to share or to inform others, maybe an opportunity to also look for collaboration with other members of the community. With that, I think that's it from my side with the community of practice. And so moving on to the actual main event of this webinar, I will just introduce Dr. Lisa Hadley, who's a postdoctoral researcher jointly affiliated to the University of Colorado Boulder and the University of Cambridge. Her research focuses on how mathematical models are used by governments and health organizations during health crises and how these processes can be improved. Dr. Hadley completed her undergraduate degree and master's degrees in mathematics at the University of Oxford and subsequently earned a PhD in outbreak modeling and policy at Cambridge. Her work also includes supporting modeling efforts for vaccine preventable disease outbreaks in the UK and globally. With that, Lisa, I will hand over to you. I will just stop sharing my screen if I can and not go yet to the questions and discussions. That's a bit too soon. Oof, let me see.
Thank you.
Does that work? Yes.
And my slide should now be up.
Yes, I see it. Yeah.
Perfect, perfect. Yeah, thanks for that introduction, Roy. Hello, everyone. Hello to colleagues who I haven't seen in a while. I've seen lots of names I recognize, and hello to new people as well. As Roy said, I'm going to be talking through one study from my PhD. I did my PhD at the University of Cambridge, but this project was actually supervised by Seb Funk at London School, who's also here today. So I'm very interested in how modelling is used and translated into policy. So this study will be really about the interface of modelling and policy. I won't talk about any of the technical modelling that goes on. So our study, which we called sort of the use and translation of modelling into policy. So just some details, and then I'll launch into the results. So it was a formal evaluation of different country approaches. We held interviews with national modelers and national policy and decision makers, and some science advisors too, in 13 countries, with at least one country from each UN geographic region. And methods were in-depth semi-structured interviews, thematic analysis, and ideal type analysis. So in terms of study countries, we tried to get a breadth of responses to see how different countries were doing things. So we looked at Canada, Colombia, Peru, France, UK, Kenya, Uganda, South Africa, Hong Kong, Japan, South Korea, and Australia and New Zealand. And then the aims of something like this sort of study, we wanted to understand how is modelling currently used in policy settings, or rather, how is it used in COVID? I guess we're a couple of years on now, with a view to thinking about how should modelling be used in policy. So as Roya said, we don't have any formal kind of guidance for these sort of data decisions, modelling to decisions pathway. And these sorts of studies can be really helpful for informing that angle. So I would say that sort of blanket recommendations. So by this, I mean things like we should communicate more, or we should work together better. I think that's not helpful. That's something we already know. What we wanted to get at with this study is some of the details and how things worked in practice. And to think about the second bullet point here, are there similarities between groups of countries or between interviewees? Are there sort of different situations that we should be considering rather than just trying to give one sort of blanket guideline? And if there are different situations, what are these kind of key contexts to consider? So the study is all published online in 2 papers, and I was going to dig into the results today. So our sort of headline result, and this is the caption for my conference poster. So working with policymakers, a best practice needs to consider modelling infrastructure and level of government involvement. So what I mean here is that these 2 bullet points were the 2 key factors we identified governing shared experiences. So what did interviewees who had sort of similar beliefs, experiences, and recommendations on the use of modelling in policy, what did they have in common? And note that these 2 key factors are both sort of structural things. We also looked in depth quite a lot at communication and collaboration, but advice on communication was a lot more universal, whereas on the sort of infrastructure side of things, we saw many kind of different groups of view. Okay, and then I will start by talking through sort of what each of these 2 are. So result 1 was about modelling infrastructure. So we saw 4 types of national modelling infrastructure among the countries that we looked at. So 1 modelling team, small teams working as one. This happened in South Africa. Multiple teams, multiple models. So this is your sort of classic modelling consortium. And an unusual 4th type where modelling teams were working independently with no collaboration. And results were sort of being fed directly into policy. So there was no sort of cross collaboration and no communication between teams. Okay, and then on level of government interaction with modelling, we also saw quite a varied range there. So everything from kind of medium to high to embedded, and by embedded I mean situations where the modelling team was a full government entity. So all of the modelers would be government employees. Could be the Public Health Department or a sort of arm's length agency. And we saw this kind of range of different things and wanted to think about were there any sort of similarities we can draw across different countries. So if you take those 2 factors, modelling infrastructure and level of government involvement, and you can think of them as axes, and using a technique called ideal type analysis, you can kind of draw together what are the countries and interviewees that had similar experiences. And what we ended up with after our analysis is this kind of figure here, which is called a typology, where we have 5 different categories that we saw of modeling to policy interfaces. So, for example, in the bottom left, Hong Kong and South Africa, these were both countries with sort of limited modeling capacity and some independence from government, whereas Peru and Japan also had sort of similar small modeling capacity, but a lot more kind of direct or embedded interaction with government. So from this kind of figure, I think this is the sort of thing that can help us think about what were the different experiences that were seen and how can we kind of classify the COVID-19 sort of modeling and policy interfaces. Okay, so moving on, Roya wanted me to go through a couple of country examples. So I've included 3 from our study, and I've tried to pick some that I think I've talked about less because I know we've talked a lot about COVID. So I was going to start with Canada as an example. So on the right here, we have some community modeling examples from the Public Health Agency of Canada. I think they're a couple of weeks apart, sort of subsequent presentations. And in Canada, they had multiple teams and multiple models, so a modeling consortium. What was interesting is that their primary modeling team was embedded in government, so in the Public Health Agency of Public Health Agency of Canada. But they had a really strong external network that has now grown into a sort of Canada-wide modeling community. And these individuals seem to have a very good sort of knowledge translation process between those within government and those outside of government. So I think it's a really interesting one to study. Modeling team, as I said, led by Public Health Agency of Canada, and their main linkage points were health, so with the Minister of Health and Cabinet in this situation. Okay, slightly different example, Peru. So this is a plot I've taken from the literature. So in Peru, they had one modeling team, this time embedded in government. So modelers were part of the CDC Peru modeling unit. And again, main government linkage points were health with the Ministry of Health. And third example, South Korea. So this is the country we saw where teams working in isolation. Medium government linkage due to, I guess, a sort of shortage of infectious disease modeling professors in the country, and a sort of modeling was quite new in South Korea in policy settings. No formal modeling committee, just a few different teams working independently. And main government linkage points were health, so with the Korean CDC. And here we have another community example there modeling. Okay, so sort of towards the end of each interview, we wanted to think about evaluation and sort of looking forward. So what were the kind of key lessons? What would recommendations be for the future? And there's a large section in the paper which goes through this, but essentially all of the sort of recommendations fell into 4 categories. So it's discussion on data, on systems, on relationships and sort of interdisciplinarity, and on communication. And these were seen as sort of driving enablers of successful modeling to policy interactions. And then as a final result, we asked a question, what was your biggest mistake? So this part of the interview was more about kind of sharing experiences. I'm not saying that any of these comments are kind of official guidance or anything, but it was really interesting to see individuals' different points of view. So I thought I'd share some with you. So we asked sort of what was your biggest mistake in on the use of modelling in policy in COVID-19? And some really interesting different perspectives. So the first one, allowing policymakers to espouse more certainty in the models than existed. Down here we have some modelers or modelling groups struggled to recognise the time and place appropriate for complex versus simple models. These are just individual perspectives, of course, but I think it's really important to see the kind of spread. A lack of resources created bias in data sets. So, for example, marginalised communities couldn't enjoy the same level of surveillance. And interviewees talked about sort of forcing national models rather than local models onto Indigenous communities. One interviewee said not believing vaccines would be available so quickly. Quite a few said not taking an interdisciplinary approach. So a lot of countries were collaborating with the sort of Ministry of Health, Department of Health, but there was sort of no opportunity to collaborate more broadly. So I think it's interesting to kind of see those individual voices. Okay, and then at the end of the interview data collection, we then synthesized all of the responses to give some kind of formal recommendations of what would we begin to think about as a sort of a guideline looking forward. And this figure, which comes from the paper, is our sort of, I guess, high-level overview. And we've got these kind of 7 categories of things that we might begin to think about if we were to develop a guideline for how modelling should be used in policy in the future. So I was going to go through each one in detail. So the first one, identify your system. So these are the paraphrased shortened versions to make it a bit more readable on slides. So actors should identify their own category with an example of our categorization here, and utilize the most relevant context-specific case studies. So basically what we're saying here is we didn't identify sort of one system that was any better than any others. But what we did see is countries where the situation was similar and sort of experiences, challenges, recommendations for the future were sort of strongly aligned. And we therefore think that it could be a useful exercise to sort of think about where your own experiences fit in, and can you look to those case studies for some recommendations of things to try and things that worked in that situation. So I think one point I wanted to make here on the categorization that we've come up with is that income status is not mentioned. It's not one of the key features here. And I also think that in this situation, country income would be a bad descriptor of the sort of level of modelling literacy or modelling infrastructure within a country. So, for example, we have Kenya, low middle income country, which had a full multi-model consortium in COVID. Compare that to South Korea, a high income country, which still to this day has very few infectious disease modelling PIs. And in terms of modelling, far less expertise to draw upon. So I think when we're first talking about guidelines, I think it can be the first thing we often think about is to stratify by income. But I think looking at these key features in a bit more detail will help sort of unveil some of the nuance of how different countries do things. Okay. So guideline, or sort of suggested guideline number 2, relationships. This one's a lot more obvious. So facilitate long-term relationships with government groups rather than individuals. So this was a recommendation to sort of protect against some of the high turnover that both government and researchers, especially early career, have. Encouragement to form relationships with sort of multiple individuals to protect against that high turnover. And point 2, where modelling is external to government, ensure some kind of modelling translator or knowledge broker or a sort of advocate within policy spheres to sort of enable that process. Number 3, standing capacity for modelling. So in limited capacity countries, supplement with active sharing via international modelling networks. Disjointed modelling efforts, this is the sort of type 4 I was referring to, is encouraged to unify to improve efficiency and quality. As we were writing up the paper, we saw a really nice example of limited capacity countries sort of training more modelling. So I've just included it here. In Latin America, Epiverse has been running a sort of mass training through an open online epi modelling course held fully in Spanish. I think it was held first a year or 2 ago. And sort of initiatives like this have been kind of hugely popular in disseminating and sort of training up more individuals who are fluent in modelling. And then we have this nice quote from an interviewee, which also fitted into this theme, so I've thrown it on the same slide. They teach mathematics and computer science, but not these epidemiology things. We need to engage with universities to train more undergraduates in these methods. And I think that's an excellent idea too. Okay, our next sort of potential guideline is on data availability. Responses from interviewees on this topic were pretty much universal. Strong data access and availability is essential for modelling. A sort of universal recommendation. There was nothing we could really break down there. Okay, and then legitimacy. So where modelling is external to government, establish operating procedures ahead of time. So there was lots of recommendations for data sharing agreements and sort of memorandums of understanding to be in place between modelling and policy where modelling was external. And second point, unifying modelling effort through consortiums was reported to sort of aid identifiability for policy in a few different settings. So the idea that where modelling teams had kind of combined themselves into a consortium, they were sort of easier to access and identify. And then we have a guidance on communicating modelling. I'm not actually going to talk about this today, but we have a sort of separate paper which contains all our results on communication and visualization. And there's a sort of handout, printable handout version here as well. But our kind of general headline message is sort of to caution against over or misinterpreted modelling. And I think there are a lot of nice studies that have been looking separately at that issue. And then last one, I believe this is the seventh one, interdisciplinarity. So science advice in a health crisis should be holistic. This was a concern by a lot of our interviewees that they either only focused on health or they were requested to only focus on health and weren't able to consider accurately any of the sort of societal implications. They were primarily asked to focus on cases, deaths, hospitalizations, for example. However, we did see two examples from South Africa and Australia where there was a strong linkage with the economic side of things, so modelers working with Treasury, for example. But we definitely need more research in these kind of examples of where epi-modelling is combined with economics or where epi-modelling is combined with behavioral sciences. I think that's a sort of an understudied area. Okay. So in sort of summary, these are our kind of suggestions or ideas for preliminary guidelines of how modelling should be used in policy in the future. I should flag that this is all focused on COVID, which was obviously a couple of years ago now, and it would be very interesting to see from the audience, for example, how your own experiences fit in. What sort of situations do you have these days? Have you seen any sort of improvement motivated by COVID? It would be really interesting to hear. Okay, and then I was just going to finish by giving a few ideas of what we've been doing recently since this study, and then we can open to discussion. So we held a researchers workshop in May last year, which actually several of you guys came to. And this was, the idea was to draw together groups who have been working on exactly this question. So as we were doing the study, we found a few other research teams around the globe have also been looking at how modelling was used in policy, science policy communication, evaluation, all of these sorts of questions, often with a kind of COVID evaluation focus. And the idea was to kind of bring everyone together for 2 days and sort of share approaches and ideas and results and so on. And personally, I found it really, really interesting and a really great experience. And I hope that we'll be able to sort of continue more of these kind of activities in the future. I think, yes. So just to give you an idea, these are all of the studies that were presented at the workshop on day 1, and then on day 2, we had a sort of smaller focus group of the individuals in the photo to kind of pull together common ideas and share some kind of future areas of investigation and future methodology. So it was a super interesting activity. I've also separately reached out to the Alan Turing Institute, who have a special interest group in visualization. So these are individuals who work in the field of vision science or visualization. So put a figure down here. They sort of study how the eye receives information and how the brain sort of processes visual information. And I think there's an awful lot that we can learn in terms of how we communicate modelling and how we sort of present modelling graphically. So it's been really interesting to kind of learn from these guys. And so far we've written a perspective where we've aimed to take some of the kind of basic principles of visualization and sort of bring them into infectious disease modelling. And then now we're thinking about if we would be interested in a longer term study and where to go next. And then I think this is the final slide. We've also been thinking about the difference between a policymaker and a decision maker. So in the interview study, we did not specify, I guess, exactly who are the policy makers that we're talking about. We were sort of deliberately broad in our definition to include sort of anyone who was interacting with the modelling and sort of working on pandemic responses. But there are a whole range of different actors within government. So you've got policy specialists who might be very scientifically literate, perhaps more policy generalists, and then you've got sort of top-line decision makers. We've been thinking about how these different actors have very different sort of timelines, very different topics of sort of concern, topics of interest, and sort of breadth of policy that they're looking at, and specifically how we as modelers should tailor our relationships to these different individuals and how we should tailor our communication to these different individuals. So that's been super interesting as well. And this one is also a preprint on Open Science Framework, and it's currently under review. Okay. I think that's everything. Yes, so I'm just finishing with a link to the 2 interview papers, and Roya can share the links with you after. But yes, I think that's everything I wanted to say. So the interview study is one example of COVID-19. But it would be very interesting to hear how individuals sort of did things differently, or if it aligns with their experiences, and how things have been since, basically. So I will stop there. Thank you.
Lisa, thank you so much for that presentation. Very informative, very eye-opening, I think, especially for me, in terms of seeing the different country examples and that the institutional, the structures, the infrastructure doesn't necessarily align with the income status, and also the importance of the role of these translators, right, and all of this as well, which sometimes is underestimated. So I think we're now going to move on to some questions and a discussion round, which I think we have plenty of time to go through. I see already a few comments and a hand raised, so maybe I'll go with Emil first. Over to you.
Thank you very much, Lisa. I was wondering because I mean the research results are from last year, and I know that you've already interacted a lot with people about your results, and I was wondering what the reception was and to what extent you have maybe heard of cases where practitioners were considering or have used your recommendations, and kind of whether you were able to follow up whether it actually helped them in improving their pathways.
Yeah, excellent question. Yeah. So I'm pleased to say this topic has been really well received. There's been a lot of interest in this type of research. I think a lot of teams have done their own, a lot of modeling teams have done their own self-reflection after COVID. But I think individuals have found it very interesting to see sort of across countries how different countries have done things. Yes, I've had quite a few, well, a lot of invites for giving talks and presentations to explicit sort of modeling teams. So I spoke to the Manitoba Civil Service on Tuesday, which was very odd, to talk through the visual communication guidance. And there's been, yeah, a lot of interest in the findings of this type of work and all of the other studies from the workshop and other work going on as well. I think there's definitely a lot of interest. We've also, I mean, you know this, but we've also contributed evidence to the Lancet Commission, which of course is looking at exactly this theme, trying to pull together some guidance on how modeling can be used in policy in the future. So it's really fantastic to sort of have interest in this topic and keen to continue in this area. Yeah.
Cool, thanks.
Great. And before I move on with the next questions, maybe just it would be great if we could, if you could also introduce yourselves to the group. Sorry, Emma, I kind of knowing you, I just jumped to saying your first name. So please also do introduce yourselves before your questions. That would be lovely. And I see in the chat there's already 2 questions from, is it Yuka? Am I pronouncing it right? You're very welcome to also ask your question if you would like. It doesn't have to come from me. I like to not hear my voice too much.
Yes. Hi, can you hear me?
Yes, perfectly.
Thank you very much for the great presentation. Actually, I am currently working on operationalizing the modeling into dengue interventions, and I'm with the collaborators from the UK. And I'm also starting a new project with another country, also for dengue. It's in the initial beginning stage, but I think I'm also struggling to kind of decide, okay, at the beginning, who should be involved and how many people should be involved? What would be the step? Like, should I form a technical working group? And because we need to sensitize the high level officials, but we also need to have a very technical discussion. So, and then people's time is limited. So we always struggle, okay, to balance how much we should involve who at which stage. And then for the project that is almost at the operationalizing stage, what could promote the operationalization? How could we make sure that this modeling is fully used? And how could we ensure the that there's like a feedback mechanism that can also like do the inform the modeling so that it can be actually useful for people on the ground level to act upon the modeling result. So And oftentimes I was asked, okay, is there any example that modeling is actually used, and how are they using? Are they using on the dashboard? Are they producing maps? Are they discussing at the weekly meeting, or how is it actually being integrated in the day-to-day work? So that's why I asked this question. And oftentimes, because modeling this result could be a little bit sensitive, it may not be publicly available. So it's hard to find the readily available example to show. So if you have any example, I would appreciate that to know. Thank you so much.
Really interesting, thank you. Yeah, so in terms of your first part about how do you ensure that the modeling is used, and how do you kind of balance the time needs of the different actors? That's a really critical question. I think a lot of our interviewees would encourage two-way communication where possible, if you can set that out from the start, so that there's a sort of a feedback loop. For example, some modeling consortiums had individuals from government sit in on their meetings. Some modeling consortiums had modelers sit in on the National Scientific Advisory committees to sort of get that kind of stronger two-way communication. Setting out kind of agreements of expectations in advance, particularly with data sharing, as I mentioned earlier. I think having a knowledge broker or a sort of communication expert in the modeling committee can be, in the modeling consortium can be very helpful as well, just to aid with the sort of translation of modeling results into sort of policy language, and to kind of take that burden off somewhat off of the modelers as well. I think that could be really powerful as well. Second part of your question, I have forgotten. Can you remind me the second part? Where do you remember?
The real example of integration
of
modeling into policy or decision making or intervention. Thank you.
Yes. Okay. Yes. So I think any of the case studies in the paper would be good examples. Our sort of sister paper looks at the communication. So you were asking about whether modeling was sort of taken from graphs or in reports or meetings and things. We kind of dig into at least the plots and graphs and figures, so reports and presentations angle in the second paper. So I think interesting things there as well. Yeah.
Thank you, Yuka, for your question, and Lisa, for your response. Prabhasaj, would you like to ask your question?
Sure. Can you hear me?
Perfectly.
Okay. Hi, Lisa. Thank you for a very, very interesting and wonderful talk. My question is, did you, in the different national public health landscapes that you have looked at in the course of this study, how is this policy modeling relationship fostered and nurtured through periods between crises? I know your focus was, of course, looking at the COVID crisis, but did you get a sense of what happens between the crises?
Yeah, that's an excellent question. So the focus was definitely on COVID from 2020 to 2022 was the time frame, and we did the interviews in 2023 and 2024, just for context. But in terms of sort of sense of peacetime, so already at the time of interviews, so 2023, there was definitely a kind of divergence. So some countries were able to kind of maintain their modeling infrastructure beyond COVID, and sort of have shifted to a kind of respiratory virus network or kind of modeling consortium sort of more permanently, which is excellent. I think we saw 3 examples, sort of explicit examples of that. whereas 2 had already disbanded due to lack of, they were sort of unable to get long-term funding, which is really unfortunate. So lots of the kind of networks that existed in COVID had been sort of wound down and kind of collapsed. We did have a sort of view from one of our interviewees that even if there wasn't a sort of formal structure in place, they felt that a lot of the relationships that had been built would likely kind of spring back together in a sort of in the kind of next emergency, and that they knew who to call on when it was needed, that sort of thing. One example that also came to mind, Australia, post-COVID, they are now working to build a CDC so that they can be sort of more explicit, I guess, more explicit space for this type of science policy interaction. So that's one kind of positive growth post-COVID example. But I think a lot, probably all of these variations depended on whether or not the initiatives got long-term funding after COVID. But yeah, a real spread in terms of what happened around kind of 2023, 2024. It'd be interesting to sort of look around and see 2 further years on whether there's been any change again.
Thank you. Am I allowed a follow-up question?
Yes.
In your survey of policymakers, especially, how much appetite did you sense for looking to help from supranational networks of modelers, looking outside national borders, and sort of like the collaborative network or other examples?
That's very interesting. Yes. So a lot of the study was the study was restricted to national modeling and policy as the kind of main focus, but interviewees did have a lot of appetite, and there was a lot of discussion about some of these international modeling efforts. So especially across kind of Southeast Asia, we have Mid-SEA now. We had lots of our interviewees took part in the WHO informal modeling calls that were ran sort of between some of the main kind of modelers from each country who were part of these sort of informal WHO modeling calls very early on to kind of share approaches and data sources and kind of directions and things like that. I think a lot of individuals found this really helpful. In terms of the policymakers' perspective, a lot of variation. I think primarily we focused on national inputs, but I think countries obviously received advice from some of these kind of WHO regional networks, these communities and things like this, sort of informal and formal structures. To be honest, I think we haven't studied it enough to say any more than that, but I think going forward, there's a lot of appetite for these more collaborative things. So I think we've seen lots of excellent tools and resources coming out now for kind of combining this modelling effort and this sort of modelling to policy effort, which is fantastic to see.
Thank you.
Great, thank you. I see another question. I hope I'm pronouncing it right. Is it Huda? Would you like to ask your question? No, maybe not. I see the question is how to enhance our skills in the interpretation of modeling work into practice, which is the big question.
Yes, excellent question. Yes, I think we can take a lot from experts in communication and knowledge translation. And I know that colleagues on the call have looked at that more specifically. I think we have, I guess we tried to get specifically at this question on the topic of visualization in interviews. And we were given sort of advice on kind of what sort of plots and figures and graphs the policymakers found easiest to understand and what was sort of difficult to understand. And we were kind of summarizing guidance on that specific topic. On the kind of broader communication question, that's a much larger question that I'd like to dig into. We focused on this visualization topic as a sort of step one, but looking into what's the best way to kind of communicate modeling in policy reports and policy briefs, in sort of presentations and committee meetings and so on, I think. That would be really interesting to look into more specifically.
Thank you, Huda, for the question, and Lisa for the answer. If there's anybody else who also wants to jump in to answer that, you're very welcome to. Colleagues, members of the community who are also working on this, please do feel free to join the discussion and mention anything. And maybe just to mention the publication that Lisa was referring to, the visual preferences for communicating modeling. I hope we can also take up Lisa's time again to maybe also present on that one a little bit more, which might be interesting for you, Huda, to listen into. I see another hand up. I do apologize. I'm not sure if I'm pronouncing the name correctly, so please do jump in. Is it Vaishnavi?
Yes, hi, I'm Vaishnavi from India. So my question might not be directly related to the topic, but I'm in early stages of my career. I'm an undergrad, and we are working with the professor on where we model heat waves related policies like where alert systems, which we are look, the project is very early stage, and we are using the previously modeled heat wave and mortality relationship to move beyond the basic threshold based definition. And at this stage, I'm still learning how epidemiological considerations should guide that next step. So my question was, which epidemiological aspects are most important to think about on an early stage, and how would you recommend to incorporate me to the project?
Lisa, I'm not sure. Thank you, Vaishnavi, for that question.
Thank you. Yeah, I caught about half the question. Would you be able to repeat? Sorry.
Yes. So my question was, we are using how heat waves are related to mortality. Like we have multiple of literatures available which relates to risk due to heat waves. As the temperature goes up, the mortality, they have the close relationship. So are there any other epidemiological factors that we should consider apart from mortality to move ahead?
I see. Okay. So this is a technical question on epidemiology and on modeling. So I think some of my colleagues with more direct modeling experience would be the best ones to answer.
And that's open to anybody else who would like to answer that question. Otherwise, if not, Vaishnavi, I would encourage you to post your question on the collaboratory, where you can, if you post that, we will have others in the community who have a lot more knowledge on this as well. Not to say, Lisa, in any way that you don't have the knowledge, but but just if there might be others who have some experience on this and who could maybe give their inputs, please do post it on the collaboratory, and I'm sure others can give their inputs.
Yes, sure. Thank you. Thank you, Lisa,
Thank you
for the presentation. I really like that. Thank you.
Thank you. Thank you. Really interesting to hear what you're working on as well. Thanks.
Great. Any other questions for Lisa? if not, whilst we're maybe waiting for others to jump in, I might just ask a cheeky question around. So Prabhasaj actually asked my question around looking beyond maybe the infrastructure, the national infrastructure. But then maybe the other question I had was if you saw any examples where there were formal agreements which made modeling outputs more likely to be used in decisions, whether it was MOUs, mandates. I think you did touch upon it a little bit under the legitimacy recommendation, but did you see any, did you observe any of that?
Interesting. That's really interesting. So short answer, no. Because our study methodology was sort of primarily interviews focused. So we didn't have a component that was looking at searching policy documents and the like. But I'm fairly sure that some of the other colleagues on this call have run studies that are looked at the sort of literature and policy angle. So it would be, that question is probably better directed to others. If anybody wants to jump in now, very welcome, or we can also put that on the collaboratory.
Thanks, Lisa. This group is quite quiet. I don't know if it's because it's maybe the first webinar episode, but no, encourage myself to post the question then on collaboratory and see if what response we get on that.
Yeah, I only have anecdotes, not sort of formal
Okay.
formal ideas.
Okay.
Yeah.
Great. Any
Excellent.
other questions? I don't see any other hands up or anything in the comments. In that case, I guess we could finish. Clara, yes.
Yeah, I might ask a question. Thanks for the presentation, super interesting. And actually I was curious because you said, so first of all, I find this typology super helpful that you created. And you said that there's no one best system. But I was interested if you found like differences in terms of success drivers' relative importance in between those different categories, countries. So if in one structure there's one success factor more important than in another one.
Interesting. That's an excellent question. I have to go away and think about it.
Sure.
I think so. The four categories we had were data, systems, communication, relationships, as the kind of driving factors of strong molecular interfaces. Communication advice was definitely quite universal. Lots of kind of common recommendations. Data again, universal. So I guess relationships would be the part that varied the most, and the systems. Yes, okay. I'll have to think about it.
Oh, no worries. Thank you.
Yeah.
Again, encourage the conversation maybe to continue on collaboratory in case I haven't promoted it. Great. All right, in that case, then I think we will wrap it up with maybe just 1 minute left. Lisa, thank you so much for the presentation. That was really, really interesting. And thank you to all those that joined, and looking forward to the next webinar, which we will post on collaboratory. Do keep an eye out for that. And yeah, looking forward to seeing you all again soon. Thank you. Thanks, Lisa.
Thanks. Nice to see you
Bye.
all. Thank you. Bye-bye.
Thanks. Bye.